My name is Dr. Barbara Eason-Watkins, and I'm the superintendent, and I should say the proud superintendent of the Michigan City Area Schools.
Hi, my name is Cathy Bildhauser, and I'm the Director of Curriculum and Instruction for Michigan City Area Schools.
I was first identified as having a hearing loss about 6 years ago, and it came about because when I had my annual exam, we just talked about the importance of hearing and being able to, participate in group conversations and listen to all of the videos and things that were coming out that I wanted to really understand clearly, and I couldn't. And so my doctor referred me to a hearings clinic, and that's when I first became aware that I had a hearing problem.
My hearing loss is pretty recent. I think it was about 2019 that I was identified with hearing loss. I woke up one morning and had lost my hearing in one of my ears, and so that was really the start of my journey.
Well, I wear hearing aids in both ears, and my hearing level is such that it's required to have hearing aids in both so that I can sit in meetings and listen carefully to what's being said, which I couldn't before. I can look at a lot of movies on my computer and I can hear what everyone is saying. And I have also been able to see some really nice concerts online, and I couldn't hear the words before. So I am really excited about the fact that my two hearing aids enable me to participate in everything that I want to see or do.
Today I have two devices. I have a cochlear implant, which is kind of hard to see, but I call it my bionic ear. And then I also have a hearing aid. And it was really working with my doctor to identify what kind of hearing device I would need that would enable me to participate fully in my job and my social life. And really today I find that I'm able to succeed with all of that because of these amazing devices. So for me, it was kind of a unique experience to wake up one morning and realize that I had lost my hearing. And it took a little bit of time before the devices before the surgery took place for the cochlear implant. And so I had to experience some really unique situations where I couldn't hear, but everything was still happening around me. And so I experienced what it was like to navigate life without any assisted devices like the hearing aid and the cochlear implant. And I relied on really watching facial gestures. I relied on friends that could lean in and kind of tell me what was happening, because I did have a little bit of hearing in my right ear without any device. But today, with the devices, it is so much easier, and really, I think for me, just learning to embrace that I could hear again with this lovely bionic ear with the hearing aid, and I can control different settings. I can turn the volume up, I can turn it down sometimes. Actually, just the other day I had to tell somebody, I can hear okay, you don't have to yell, raise your voice, because we were just in my office, and so I found myself turning the volume down because it was just, on my normal setting a little too loud. So really learning how to use them in the different situations to help hear.
I don't have any obstacles per se related to the hearing aid. The one thing I would say was sometimes difficult wearing a mask and the hearing aid at the same time. I actually lost one of the hearing aids once and had to replace it. And so I had to really check around and find a type of mask that I could wear during the pandemic so that I could ensure that I could hear and I was safe at the same time.
You know, it really is just learning how to use the different settings in different situations. Like a social setting, I can filter out some of the background noise to help. And so just really learning to be the driver of my tools. So embrace the uniqueness of hearing loss and really recognize, like I call this my bionic ear. Not everybody has one, so that makes me unique, and it also makes me, sometimes I can hear things that other people don't hear because they don't have one. And so I can hear like the ticking on the clock, or I can hear something far away when it's quiet that somebody else doesn't pick up because of how the cochlear implant works. And so I just think I have that special superpower that other people don't have, and that makes me unique.
Well, I would say to all of our students who are hearing impaired, I wear glasses, which aids in my ability to see. I wear clothes so that when I go to school, I'm dressed appropriately, and we used to say always dress for success. And I wear my hearing aids to ensure that I can be the best that I can be. So wear your hearing aids proudly. We love you, and we love the fact that you are proud to be a Michigan City Area School student.